Hi guys! Today we are doing our presentation on therapeutic recreation. So what is recreation? It is a form of treatment that uses recreational activities and experiences to improve one's physical, emotional, and social well-being with disabilities, illness, or other conditions. Mostly focuses on sports, games, activities, community outings, and all kinds of other fun activities. It is also known as recreational therapy or RT. So the person that we chose to discuss with for our project was Alexis Soladerupt. I apologize if I'm pronouncing that wrong. But she is currently not working with students, but she had a lot to say. So she was first introduced to special education by her mother in high school, where she was introduced into the classroom, taken on field trips, and taken to other activities. She volunteered at a bunch of facilities, especially at her grandmother's dementia wing. And she also had other fun summer activities, such as a kayaking program in college. She worked for a community recreation center where she learned to come up and adapt with different activities of all age groups and all levels. And she really, really enjoyed working with the visually impaired or blind. She then took classes at Sacramento State University, where she took a class on RPTA, and then she was introduced to Shutter Health PACE in Sacramento, where she continued to grow her education on recreational therapy. She then realized very quickly, quote unquote, at the top, I realized that children were not my favorite to work with and went back to aging adults at Well-Paced Health. She learned rather quickly that, you know what, the young wasn't for her, and that's okay. So she went back to Shutter Pace after getting more education and continued and has been there ever since. She liked to work specifically and took on many patients, specifically stroke patients, and she's been doing that for quite a few years now. She also has worked with a lot of other different groups there, and she's really learned that you have to be vocal and connect with others in order to get the people you're working with the best quality of life and activities. She's also nationally certified in RT as well. So, how to become a RT or therapeutic recreational specialist? In order to do so, you have to have a bachelor's degree in a related field. These related fields can be psychology, exercise science, kinesiology, or even therapeutic recreation itself. You also need to take the NCTRC, which is similar to like a CSET in a way, but it's a little bit more difficult, and obviously you have to pass it within a certain criteria in order to become a therapeutic recreational specialist. So, one of the questions that we discussed with her was how do you stay current in your profession and how do you keep yourself up to date? Just like Dr. Bittner's talked to us, she says you have to go to a lot of conferences, kind of put yourself out there. She loves to learn, so she loves to do research and go out of her way and come up with new ideas. Her biggest thing was never stopping to learn and trying new technologies, and it's okay to fail because you gotta try something new and just keep going.
Another question that we asked was if you were to give an individual who's entering the field advice, what would you suggest and why? Overall, she said that you have to have thick skin for this industry because um, overall, when you're interacting with multiple people, you may be criticized not only by other like occupations, but also just the paperwork and also all the critiques that come with it. She also said that you have to have a positive outlook and the ability to adapt to different situations, environments, and personalities. I really liked hearing that from her as well as other professions because it just shows how adaptability in this area is so important. You also have to have a passion for the population you work with. Like she said previously, we were working with students, but then she found out that she actually likes the elderly population. So having that passion to really care for your population is important. You have to also do your own recreation to refill your own cup. So while you're doing your therapies and all the documentation that come with that, always scheduling that time for yourself, kind of like how we discussed in class previously for our guest speakers. And then lastly, you have to advocate for your profession. Specifically in recreation, sometimes there is this outlook that it's not needed. However, it can be very helpful, especially in schools and healthcare settings. Another question we asked was, what do you believe are essential skills to begin an effective professional? Um, so to be an effective professional, you need to learn how to take feedback and emotional feedback. This was really important in this process because if you can't be open-minded to grow, you could be repeating wrong information and long-term affecting the students or whatever population you're working with. Another thing is that while you're getting this feedback and working with those populations, you really have to be patient. It may take time to see results, and also determining whether this is a good boundary or not. You have to really figure that out for yourself as the time progresses, but you won't see impact right away. So give yourself patience. Next, we're going to be discussing how to connect RT to public schools. So recreational therapy and public schools through Individuals with Disabilities Act, recreation has been reaffirmed as a related service. One of the primary purposes of therapeutic recreation in schools is to help students learn to use their leisures, time consecutively, and in ways to improve their overall quality of life. Recreational therapy outside of public school. We were discussing like the importance of other options. Therapeutic writing and therapeutic surfing are both very beneficial. Therapeutic writing and surfing, you can both focus on something that's therapeutic and control your heart rate. So with the riding course, if you were to work with the horse and just by simply like grooming them or walking with them, the heart of the horse actually syncs up with your own. So helps lower that heart rate and stress to a manageable level, and you build a connection with nature during that process. Same goes with surfing. However, this is more of like the synchronized movement of the waves. And also it's a occupation or hobby that could be somewhat challenging for our students. So it's a good push if they want something a little bit more challenging than the everyday sport, but also it can be very meditating when you're out with the beach or the ocean. These were just some similarities and differences. We'll go in depth a little bit more, but overall, the way APE is and RT is one's more education based and the other is more focused on recreational leisure activities. So in APE, we do physical activity within classes or other educational settings, whereas an RT could be in a hospital, like with the elderly population, schools, or even community centers. The therapeutic approach for APE promotes physical education, motor skills, social skills through adapted PE activities, whereas therapeutic approach for RT is recreation as a tool to address those same goals, such as reducing that stress or depression, improving one's motor skills, and building upon other skills. And then the similarities, they're both promoting physical and emotional, social, and cognitive well-being. It just may look slightly different, but you're essentially targeting the same goals and settings. Apart from the IEP plan, they both give an assessment. So regardless whether you're in a hospital setting, a school setting, outdoors or indoors, you're both going to be able to have these assessments that discuss social, emotional, and physical cognitive assessment skills. They also promote inclusion in both. However, the difference is RT focuses on recreation and leisure activities to enhance their quality of life, whereas physical education is more focused on same with the ADLs. However, this is more the short-term goals that you can accomplish within the classroom. This could be great for more like transition, but the focus is slightly different. The AP goals are also different. For the RTs, their leisure skills and attitudes, interests, they all address a variety of activities, but in recreation specifically. APE also focuses on modifying sports, motor skill development, and fitness activities, and other movement based, whereas recreation, there is modifications, but there is a big overlap of how inclusive it is. Like if you're going to be grooming a horse, you're not really going to be doing too many modifications to do that activity. Whereas if we were to go play soccer, we would have to change the ball, the location, and other rules that go with that.
When it comes to recent conferences and associations, the American Therapeutic Recreation Association held a conference to empower recreational therapists and organizations through tailored hosted conference experiences, allowing them to thrive. Their website states clear values and services that they offer to include marketing and design modules for in person or hybrid events. Another thing that was also online is the Therapeutic Recreation Conference that was on Zoom in this last February. This was intended for an audience of current, future, and retired professionals within therapeutic recreation. However, it was also open to related professions. So, if you're interested in looking more into this or how your profession can overlap with them or collaborate with other recreational therapists, I highly suggest looking at this opportunity for the future.
And that is our presentation. These are just some references that we used.